I'm going to be giving my patient Bob Owens lorazepam through his PICC line. So I have the MAR here, and I'm looking at the patient name, Bob Owens. It's the correct date of birth, 9/22/1933. I see he does have an allergy to morphine, but I've already contacted the doctor and let him know that morphine is listed as a medication to be administered, but he has an allergy, so that's being changed. I do see here he has lorazepam, 1 milligram to be administered via IV push every 3 hours, PRN for anxiety. His last lorazepam he received was 4 hours ago, and he did just ask for more because he's feeling anxious. So I have my lorazepam. I have lorazepam 3 mLs in 2 milligrams and 3 mLs. Expiration date is 12/20/20, so that's good. I also have my saline flushes, and those expiration dates are good as well. They're good. And I've already checked in my compatibility book. He has his PICC line for dialysis, and he doesn't currently have any IV fluids running, so we don't have to worry about compatibility with that. I did check, lorazepam is compatible with normal saline, and it's to be administered over 1 to 5 minutes, so I'll be administering it over 1 minute today. And the first thing I'm going to do is draw up my dose, which I've already done my math right here, and it's going to come out to be 1.5 milliliters. I can't with this mask, it's awful.
You're going to do the whole 10, so you can pulse, or you can just put the 5 in, and then you can pulse the last 5.
Alright.
Okay.
I'm taking my medication and my MAR.
5 with the peripheral, 10.
Okay, patient Bob Owens, date of birth 9/22/33, medication lorazepam, 1 milligram, which comes out to be 1.5 mLs. He's to receive it every 3 hours for anxiety via IV push. I have Bob Owens, 9/22/33. Medication is lorazepam, 1 milligram via IV push, which is a 1.5 ml dose every 3 hours, and it is due now. Bob Owens, 9/22/33. The medication is lorazepam, 1 milligram via IV push, which is 1.5 mLs, which is what I have here, via IV, I already said that, IV push, PRN, and it is due right now. And then I'm going to put my label that I've pre-made, and it matches what I have in my syringe.
And with the PICC, you have to pulse.
I'm going to put this back on.
All right, good. You're on your way.
Then these. Hi Bob, my name's Kaylee. I'm your student nurse. I'm here to administer your lorazepam. Can you verify your name and date of birth for me, please? He says Bob Owens, 9/22/33, and that matches what's on his wristband. All right, Bob, I'm going to be administering your lorazepam medication. Do you have any questions or concerns before I do that? And he tells me no. So I'm going to put my gloves on.
All right, I'm going to run down upstairs and then I'll be back down.
And before I administer the medication, I'm going to take a look at his PICC site. I'm checking the area for Rita. I see no redness, ecchymosis, edema, or drainage. It all looks good. And I know that I'm going to be giving the medication via the red port because I checked the chart and that is the port that's dedicated to medications. So the first thing I'm going to do is get my rights out of the way. So I have my patient, Bob Owens, which I verified, date of birth 9/22/33. He is to receive lorazepam, 1 milligram, which is a 1.5 ml dose via IV push, due now. Again, I have Bob Owens, 9/22/33, to receive lorazepam, 1 milligram via IV push, due now, which is a 1.5 ml dose. I have Bob Owens, 9/22/33, he's to receive lorazepam, 1 milligram IV push, due now. And that's what I have in this syringe right here. First thing I'm going to do is clean the port. I'm going to unclamp it. I'm going to prepare my saline. And I'm going to administer 5 to 10 mLs of normal saline.
Somebody's gonna react like that to me is like saying somebody like telling somebody they're in pain. Right. I'm like, yeah. She's like, I honestly hated these questions. Okay. Really? Stop letting me stuff. I know. But I mean, I'm just nervous because I don't know what I just don't know what to expect next time. Yeah, exactly. Like I figured usually the first one is like I take the first test and then after that I'm like, okay, now I know what to expect. I know how to study it. Yeah. I feel like this class is not that way at all. It's been different every time. I know. I feel like it keeps getting worse. Well, I did decent on the first one. I did okay on the second one, and the third one was the last one was my lowest grade. I mean, I still passed, but not very well. No. Yeah, I agree. I'm sitting at like an 82 right now, so like I'm passing, but you know, it's nerve-wracking. I just don't have well, and I have a couple of my friends that are taking this class too. We've been talking back and forth, and our first discussion board, that's it. It killed everybody.
All right. I'm going to be administering the lorazepam over 1 minute, so I'm going to use the clock right there. I'm actually going to remove my label so I can read the syringe better.
I mean, now, like, I have all the
The exams, yeah, that's all I got left to do. I almost wish there were like some discussion boards, cause I honestly don't find it that strong.
I don't like practice.
I'm pretty decent with the practice, cause like going over the information over and over again, and I'm one of those people, I'm terrible at reading the book, cause I'm bad at reading.
Because I can't
Yeah,
sit there and read all that.
I can't concentrate.
And then, yeah, I just,
But,
it's annoying.
well, and then their big thing was like, focus on your like assessments and your interventions and your therapy, you know, therapeutic.
And I'm monitoring the patient for any adverse reactions.
And then I had an exam next to it, I left a freaking pharmacology in there. And I didn't focus all that much on pharmacology, because I was more focused on like
Everything else.
everything else. Because they tell you that's kind of, that's what kind of screwed me for that one.
And then I'm going to administer an IV flush of 5 to 10 mLs at the same rate that I administered the medication, so over 1 minute.
But then like I told Becky about the last exam, I said, the color and stuff, I said, the only thing that Mom taught her was cleaning up. I said, she never touched her rectal.
I'm gonna
nothing else in between.
pulse that in.
That's true, because she did only say blue and black, and I remember,
One of the questions was rectal.
yeah, and I was like, yeah. Should take mine in my car at work. Well, work at 5.
Well, it said somewhere like a 40-minute drive to Kansas, so it's not terrible. Get home and put my pajamas on and take it. Maybe I'll have to do it again.
I've been doing that. It helped.
I don't even care. So is next Tuesday, are we just pretty much like practicing all?
One more time.
We don't have any videos due Tuesday.
So you anymore, so.
It says we have the chest tube
Oh,
open
yeah, I gotta show us chest tube stuff.
but we don't have to take any
Now
videos.
close the clamp per facility protocol.
Practicing everything Tuesday and then Thursday we can.
Yeah.
I would clean up my mess. Okay, Bob, do you have any questions or concerns regarding the medication I just gave you? And he tells me no. I'll make sure that he has his call light and that he's in a safe position. Get all my stuff out of here. Alright, and I leave the room. I'd wash my hands, and then I would document, pretend I'm out of the room, I would document the date and time that the medication was given, how much was given, that it was administered via IV push, that it was administered over 1 minute. I would also document that normal saline was used to flush and how much normal saline, which is 20 mLs. I'd also monitor if the patient had
This is actually been a lot.
and the patient's reaction, and my assessment findings when I checked the dressing. That's it.